Advocacy Help Desk, where advocacy comes to learn, laugh, and make advocacy fun. Here are your hosts, Brian Fratkin and Andy Polk.
Welcome back to the Help Desk.
Welcome back to the Help Desk.
Advocacy Help Desk is a network of advocacy experts, innovators, practitioners, all working together to try to help you with your biggest challenges and issues. It's a free service. You can look us up on advocacyhelpdesk.com. You can drop in questions there and get help in real time. And we also run this great live show. And I want to thank our partners for helping put this together, which is Brian with Spark Influence.
Hello.
Advocacy Software, and then also Blake with Human Factor, which runs a lot of media for a lot of associations, but mainly podcasts. He does our podcast.
Flash briefings with Alexa now. That's kind of fun.
And so our two partners really help us put this together by one helping build our website and operate it.
And all the data behind it. And then also giving us studio time to run this great program. And allow us to have great guests on and have great conversation about what's happening in advocacy today. And the really cool thing about this live show is it's broadcast across the U.S., across the world, really. So anyone and everyone, worldwide. Get your microphone out, worldwide. Oh, boy.
But in essence, what's really cool is instead of just having an event somewhere and having one topic, this show allows people to, you can write it on your chat box in real time and ask your questions, and we'll talk about them. So really, it's a personalized show where whatever you want to talk about, we'll talk about. In the meantime, we have our own topics that we want to discuss. There's a lot of things happening and churning in our industry. And so let's get right to it. I want to really thank Matthew Wright, who is the Advocacy and Outreach Director for the Children's Hospital Association, for being here with us today. Matthew, welcome.
Welcome, Matthew.
Thank you. Glad to be here.
Matthew is someone that does the good work day in and day out. And the first time I met Matthew, and you have stories too. You have probably better stories, but
he understands how the game is played.
He does.
He does.
He's an insider.
In
the best possible term.
In the best term.
But in essence, we sat down and we were talking about some stuff, and I remember we were tailing off and we were about to leave, and I was just like, so what are you doing now that's like, because I'm always trying to pick up tips.
Of course.
No matter how long you've been in advocacy, you're trying to pick up tips. Absolutely. And that's how you know when someone is serious about advocacy, when they're saying, what are you doing?
Right, yeah.
And Matthew's like, man, I'm just going back in the database. And I was like, yes, like someone that actually is doing the real grind. I mean, everybody talks about the flashy things, but if your database sucks,
you're screwed.
How you can get your message out, right?
That's right.
So Matthew, do you believe that children are the future? Is that why you're at the Children's Hospital Association?
There's a loaded, easy question.
Yeah, no kidding. I mean, my tagline is children are 25% of the population, but they're 100% of the future.
Look at that.
Nice.
Wow, that was a tee up really well. I knew it,
Clip it.
Parlay directly
Done.
into that.
That's
so when we talk about Children's Hospital Associations, as we start the show, I always want to let people know what issues you advocate on. I mean, healthcare has a unique set of policy issues that you focus on. But you guys also have a unique network of hospitals across the country that are doing really fantastic work, serious, intensive work for kids and their families. So maybe just tee it off a little bit about where you are positioned with the network and your association, but also the issues you deal with. And then after that, we'll just hop into some key hot topics. How about that?
No, sounds great.
Awesome.
Yeah, I was going to say, as corny as it sounds, I can honestly get up in the morning, look in the mirror, and say that what I'm about to do today, like I'm doing it for the kids.
Yeah.
I know it sounds extremely
No, it's
corny,
not
but it's
corny
true.
at all.
Not corny at all.
I think, I've worked on behalf of different entities in healthcare, outside, other types of, I've worked on behalf of clients all across different industries and all that. It really is rewarding work. And I sincerely mean this. The great work that our member hospitals, children's hospitals across the country, large and small, are doing on behalf of kids with really serious medical conditions that otherwise wouldn't have access to the care they need. It is just absolutely inspiring when I have an opportunity to go and visit some of the hospitals and see the work that they're doing. It just further inspires me to keep doing what I'm doing and then do even more. And so certainly through the Children's Hospital Association, our we're a member-based organization of most children's hospitals across the United States, and we certainly are quite active in the advocacy space around a lot of health, various children's health issues. Ranging from children's health coverage and access to care to the specific quality and safety measures for those kids, both within our hospitals as well as elsewhere through the healthcare system. It's really gratifying work, really inspiring to see the advances in healthcare. For instance, a lot of kids that unfortunately may not necessarily have been able to make it because of such medical complexity a generation ago now have a chance. And so that really does inspire me in the work that I do every single day.
So I love this question we like to ask at the beginning, and I know Andy has his sort of talking points but misconceptions, right, of it's what is it, $7 billion or $8 billion or what was it, 855 Starbucks coffee cups, or
that's right.
Right. So what was that stat?
So for footwear, obviously we try to tell visuals the same way that you guys do, but in essence, the current duty bill every year on shoes coming into the U.S. Is $3 billion, which is the equivalent to providing 855 grande Starbucks coffees to everyone in Manhattan.
It's just insane. It's just insane. And those are the kind of things that we love to talk about. And so what is sort of the one misconception that you deal with in terms of, and I know we talked about it once in terms of like Medicare or Medicaid or something like that, in terms of what is and isn't covered, or just one thing that you want people to know, a did you know, a myth buster, something like that.
Yeah, actually, one of the biggest things that people don't realize is interesting, because we encountered this 2 years ago during the healthcare reform debate, is that most kids get their health coverage. Most kids in the United States have their health coverage through Medicaid.
Really?
Which more than commercial or private insurance or other types of health coverage are more than 30 million kids across the country have Medicaid health coverage. Now, what's great about Medicaid is it provides a really unique, what we call pediatric benefits, because it was initially set up in the 1960s as an entitlement for children, pregnant women, and seniors. And so the types of benefit of coverage necessarily under Medicaid is very unique, and the majority of the kids who come to our member hospitals have Medicaid. So so Medicaid is incredibly important to the access to care for families that are not just pursuing care at our hospitals, but really for kids across the country.
Because you would think it's seniors, right?
Well, that's
low income.
That's where the problem happens. Is like they bulk it together with Medicare, and then they say, "Oh, that's only old people," or folks that can't afford their health care may get that, but like they don't think it's the kids. Right, and they don't put those pieces together.
Well, with Medicaid, for instance, one of the biggest misconceptions as a result of the ACA is that, which expanded Medicaid to the childless adult population, or at least again, it was states opted into, or had the opportunity to opt into that. And so, for instance, during the repeal and replace efforts 2 years ago, a great misconception out there, particularly among members of Congress, was that Medicaid was, at least that that so many, and that much of the population anyway, had Medicaid now as a result of this expansion under the ACA, and that's not true at all. It actually is. I don't want to quote a specific statistic, as I will say it's somewhere between, if I recall, about 10 to 15%, maybe even less than that, of the entire Medicaid population, current Medicaid population receives or has coverage through Medicaid right now. The number one population that has Medicaid coverage is children.
Oh, wow. Well, I think what's really interesting too is, and maybe this is leading into some hot topic discussion around our industry right now in association world and advocacy world, is it's so politically charged. Healthcare is so politically charged and has been for almost a decade now, as we've had these conversations. Maybe, obviously longer, but ever since Obamacare, the ACA was passed, and even now with Trump going in and trying to repeal it and replace it or not replace it or not repeal it. So you've got people across the country, good people on both sides, that are pro-Trump or anti-Trump. And so you've got to balance, those folks in healthcare system and the healthcare providers, and when you're sending out information, I guess you got to be really careful about walking a fine line and advocating. So how do you strike a balance in between the visceral nature of politics around healthcare? How do you strike a balance in making sure that you get people on board and you don't alienate people, and you but also there's so much fatigue as well. Like, how do you keep people energized? So what do you think?
No, it's a great question. For us, we're, and one of the things that I'm really proud of, what we do at the Children's Hospital Association, is we really do have champions on both sides of the aisle.
Yeah.
And we really strive to strike that balance. And certainly when a program that is so vital to children, and particularly the kids that get care at children's hospitals, is under attack like it was 2 years ago, made it very, very difficult, because champions that we had on one side of the aisle, but otherwise were for these Medicaid cuts and repealing the ACA. They're with us on many issues, but then they were obviously we just had a difference of opinion on this particular issue, which to us was incredibly important. So we really, a lot of it I think is really tone, and I think a matter of what we say, how we say it. That said, in this hyper politicized environment, we do certainly work with a number of coalition partners in the child health space.
Right.
Some of them, you can say bipartisan and all that. Some of them certainly do have, different, maybe stronger relationships more with one side of the aisle compared to the other, not making any judgment calls on that. What we really try to do is continue to sustain those relationships through that time of trial, knowing that no matter, while this was an incredibly important issue, for instance, what we encountered 2 years ago, we're going to need those lawmakers. We're going to need their supporters out there at the grassroots level across the country for the next for the next thing that we're advocating in support of or protecting against. Again, maybe a few months or a few years down the line, which is so it is definitely a tightrope, but it's something that we've tried to be really very, very careful about how we do that. And I'll just share really quickly an example of how that's come to fruition. We had been advocating on behalf of a piece of legislation even before the hyper-politicized, most recently 2 years ago, around Obamacare or ACA. Even before that, it would basically change how Medicaid, the Medicaid program, is for particularly like the sickest kids that are in the system. They're about 6% of the Medicaid population, but of the child Medicaid population, but they account for 40% of the costs. So we and our partners had a proposal that ultimately would improve their access to care and reduce healthcare spending as a result. So we were able to work with people on both sides of the aisle, and through several different Congresses. We kept getting a little closer. Just like anything else, when you're trying to pass a piece of legislation, you kind of put the stake in the ground, which is what we did. Our hospitals did in 2014 when the bill was introduced, and then each Congress got a little closer, and even by the end of last year, it passed through the House with 400 votes, but then ran out of time in the Senate. It was during the lame duck session, and so had to reintroduce it again this Congress. And then, but again, due to all that goodwill and strong support that we were able to, we and our hospitals and our partners were able to cobble together over the years, it passed through both the House and the Senate and was signed by the President into law last month.
That's great.
So,
great.
That's great.
So I think I share that in terms of an example of necessarily of how we navigate that, lessons, certainly our lessons learned, but then how that can help you down the road.
Sure. So, I mean, look, I would love to talk to a little bit about the pieces that go into that, right? Because we all know that, I think, two misconceptions. One is that this is an immediacy kind of concept where it's not a, like, let's plan this out kind of thing. And two is people just don't know where to start, And so talk to me a little bit about some of the storytelling that you guys are doing and the pieces that you're putting together so that you can tell the story not only today but tomorrow and in the future. And then let's talk about technology, because I love that. But
I wonder why.
But let's talk storytelling just in general. What are sort of the building blocks for the stories that you're trying to tell?
Yeah, no, that's a really great question. For us, really is, especially when the families or the individual doctors or nurses are able to talk about their firsthand experience.
Gotcha. Okay. So firsthand experience, obviously, check that box. That's one thing that we obviously need in every district where we can.
No question.
Is firsthand experience with the issue. And
Correct.
in this case, it's Children's Hospital. So
That's
you're
right.
looking at not just the family members, but the physicians and anyone that's supporting that to be able to then comment on the story itself.
Correct.
Or provide their story
from their perspective.
Exactly.
Right?
Okay, great.
Exactly. Obviously, if they're a healthcare provider, whether a doctor, a nurse, something like that, they may have more than one example. That they obviously have to be a bit careful about what information they share to patient privacy.
Of course.
But yes, but they can they can talk about, they can provide examples.
Right.
Obviously, the families can share as much as they are comfortable.
So don't just
sharing.
think about the person involved, but
Right.
think about the other people around the person who are supporting them.
Correct.
Husbands, wives, etc.,
Yeah.
whatever it might be, who also have the firsthand experience that you
That's right.
guys can then use.
That's right.
Okay, good.
Yeah,
All right, that's
and
good.
I can tell you for us, I mean that really, there's sort of this debate out there in terms of, at least I compare between like grassroots and grass tops. So
Of course.
Grassroots being where these stakeholders, again, much closer to the ground. Again, in our case, it'd be these families, these individual healthcare providers, and all that that can provide their testimonials. And then you've got sort of the grass top, which may be your hired lobbyists, or maybe senior level staff or executives that are affiliated with that particular organization. In our case, it's the children's hospitals or children's health systems. And so where then you really can't do one without the other.
Right. Right.
And so you can't do you can't just have the hired guns necessarily anymore and expect that you're going to push it through Congress because
What?
I know it's hard to believe, huh?
I thought money solved everything.
Putting people out of business here, Matthew. Come on now.
They do. But at the same time, they're also they are accountable to their to their constituents, and so hearing those firsthand. That's why I wanted to frame it like that, because that's where those testimonials are incredibly powerful.
Right.
When you're meeting with someone from your district or from your state, and who not only will share their story, but they are part of often family networks, for instance, or clearly. Doctors and nurses and other healthcare providers are part of professional associations, not just within their hospitals, but throughout their states and throughout the country, where they can say, listen, I'm sharing with you my story. But there are hundreds or thousands of other stories just like this.
Right. I love that. So step one is looking for not just the firsthand story, but also sort of the related people around that who can give their story.
Right.
Part of that too then is this yin and yang, right? We've got the grass tops and we've got the grassroots, and we can't do one without the other, right? And I think that's where people get the misconception of like, well, I hired a top gun or a top lobbyist, they'll take care of it, and it's like, well, you still need the personal stories of the constituents that live in the district to actually get something done.
Right.
Or the flip side.
How's it going to affect people in my state and
Of
my
course.
district? Sure, you need the research, you need the data, you need someone who can ultimately make that policy argument.
Where's my bell for data?
But then how
There it
exactly?
is.
But then ultimately, how is that then? And likewise, then complementing that with how is this going to affect individuals, or whether it's an industry,
Yes.
or there are individual families, or doctors, or nurses, again, whoever the stakeholders are within my district or within my state.
Right.
And do you guys primarily tell these stories in fly-ins? Are you doing videos? Do you post up stories online?
Any
What are
AR?
the channels that you're doing? What are the channels that you're using to kind of cobble these together and package them?
Yeah,
and send it out?
really all the above. So, of course, so we do fly-ins. We do an annual one with patient families where children's hospitals identify and then bring a patient family.
Sure.
So it's not usually just a child patient. Remember, you're talking about mom and dad, maybe siblings, sometimes
Right.
even grandma or grandpa, or
Nice.
or even their if they need a nurse or something like that. Bring them to DC, meet with their lawmakers. We also then do a lot through social media, through digital properties,
Of course.
to be able to share those stories with, again, really build our goal through CHA is we build a community called Speak Now for Kids that where it's really a community of what we call champions for children's health. So it's a lot of the between the parents and the grandparents and teachers and doctors and nurses and so on. So when we share those stories, when they're sharing stories with one another, and then we elevate certain stories that too, it's a very supportive network.
That's awesome because you're energizing, you're keeping people engaged, you're letting people know they're not alone. You're making sure you're the kind of the hub of those conversations, and then you move those pieces where you need to, where it moves the dial. There's this thing today that is kind of this buzzword in advocacy, and we talk about things, but social influencers, right? So tell me what you think that is, and then when you talk a little bit about finding the champions, right? So we always want to find the champion. That's like in our industry, it's finding the one person who may be the loudest person in the building and is willing to go cubicle to cubicle to grab people to do something, right? So it's a little bit, I guess, social influencers are somebody that can do something more on social media. I don't know. Unpackage what you think the term means and then how you guys do it.
Oh, there are probably like 1,000 different definitions of what people mean. To me, I think, certainly when people reference social now, they give it more in the digital in terms of social media. But really, I mean, sort of just unpack for a moment just the word social itself. And so it is an opportunity, for connections and for people, or usually individual people or groups of people, to necessarily connect with others. And then that's where then the influencer side, in order to influence toward a desired outcome. And so in that respect, sure, a lot of it these days, particularly the reference is online. So identifying, for instance, for us, it may very well be someone who has a higher profile, that again, I don't want to say whether celebrity or mini celebrity in terms of again, maybe not be a household name, but still someone who's got a really strong following, like whether again on social media or elsewhere. But it also can be, especially in our space, it's a bit unique, and there are, these can be identified industry by industry. For us, there are a lot of parents in particular, or doctors for that matter, and nurses who have their own YouTube channels, or have or through social media have really strong, again, and I really identify even like say like 1,000 followers or more. Basically, it doesn't necessarily have to be super large.
Right.
The passion behind it is what's important. So you could have like 50 really passionate people. So whatever whatever that person shares, the people who see it are going to take that desired action, or they're gonna engage with it there too.
So how do you find those people? Is it kind of you roll up your sleeves and look through your network and your database and find people and other people tell you?
Combination of software platforms
how do you do
that
that
may be able to help you with that.
I don't know.
I will defer that latter part to Brian, because I think I'll be honest, he is an expert on that particular part.
Speak, Brian. No, look, social influencers. You're exactly right, and I love that because it's another thing that the council mentioned as well. Is it's sort of like, it's not just reaching 1,000 people, but if I'm reaching the 100 that really matter, then that's what matters the most, right? And so we actually, just as an aside, we just launched something called an effective open rate. And it's basically saying, let's cut some of the dead weight out of some of the larger databases, because a lot of groups are judging their open rate based on, say, the total number of recipients for an email, when really half of them may have never opened an email that you've sent in your life, right? So why are we making these judgments on larger calls when those folks aren't even participating or aren't even coming close to participating? And so it's things like that fascinate me when it comes to the data. And so being able to say, you know what, yes, this person has 500 followers, but when she tweets something or he tweets something, 50 retweets happen because of that. So it doesn't matter to me that they're not 10,000 people, and they're not, Carrie Underwood was a big one. She, I think not one of your efforts, but a different healthcare effort a few years ago. She retweeted something, and that was great. Fantastic, obviously. But finding those folks that are able to then have those networks that also really highly participate, that's fantastic. And so you're looking for those folks. You've helped identify those folks. Do you send them specific messaging that you're then asking them to share on your behalf?
That is very much what we do. So I think that's part of, I like to use the acronym TOM, which is sorry, we target, we optimize, and then we monitor.
Fantastic.
And so,
love it. TOM. Target, optimize, monitor.
Correct.
Right,
so
great.
the targeting, again, is the first component. So identifying, other, and you can do this particularly with social media, certainly in terms of your among your advocacy database, for instance, through your software, you can do surveys to be able to identify, different affiliations that or connections necessarily that individuals in your database may have. So we've done both of those. We've done between social media, within our database, we've surveyed. And so with then those with those data points, then we can then begin to target in particular ways. So if it is, let's use within our database. So then we can tailor messaging and tailor desired actions we want those people to take based off of particular motivators.
Yeah, absolutely.
And then very similarly then on social media, identifying those again that may have, that otherwise have an interest. They're using key hashtags. They're engaging with things around key hashtags, or otherwise engaging with your content, or likewise with similar audiences. So meaning like other organizations or other individuals like that may look a lot like your following.
Right.
Then you can begin to engage with those people in appropriate ways.
How many people do you think you have that are social influencers that you work with? Or is it a small group? Is it a large group? Are you trying to enlarge it? Are you like Carrie, like on the Showtime show, Homeland, like stretching things out on the wall, trying to make the connections.
That's right. He's got the yarn going.
Yeah, exactly.
Through.
Like what?
Exactly. Circles
how do
on the
you?
wall.
That's right.
Like, what do you think is an optimal number? We have limited time and we have limited resources in advocacy, right? Like, obviously, all of our associations aren't the biggest. Like, don't have pools of money to do this. So, how many do you think is optimal, and how do you grow that and maintain that? And
I think start with one.
Yeah.
It really is that simple, because if you don't have any at this point, like it's no reason to be discouraged.
Right.
You have to start somewhere.
Right.
Yeah.
And so I'm not sure there's necessarily an optimal number, because the key is identifying and engaging the right people around it. So again, if someone can find 1,000 or 10,000 or more of those types, you're in a really great position. We're talking about based off of all the criteria that we've been talking about here. Even just one person who's willing to do that can have such an impact. And what's great is once that person identified, once a relationship is cultivated with that person where they're willing to do that, it will definitely help advance your advocacy in ways that, again, with limited resources.
See, I need to adopt Tom, because my approach has been who dat. And who dat hasn't really worked that well, because you have a whole system, and I'm just like, who dat? Maybe we engage. Like, you have a whole program. So I think that's
Tom is great.
We always clip highlights from the show, so that's a highlight right there.
I think Tom, and start with one, baby. Start with one.
Tom, just start with one Tom.
Start with one Tom.
Right.
There it is.
Eventually, you get to Tommy, and it keeps expanding.
That's right. Yep.
One of the we've talked a little bit about data, but data now there's all these great software platforms that you can use. One is Spark Influence, of course, which we use, and it allows us to see who takes actions, and then it automatically profiles that person, says this person's taken 6 actions. This may be a VIP you need to look at, which makes it super easy for me, who doesn't have time, because it's not just that I'm doing advocacy, I'm doing operations and I'm doing marketing and branding.
How it is in most advocacy.
Right, so it's everything that we're all stretched a little bit. So having that is there. But then I had I did cybersecurity on Capitol Hill for a number of years. So I have it in the back of my mind, how systems need to be secured. But even I sometimes forget, right? We all forget on our personal devices until something happens and there's a breach at Target or something like that. But there was a really bad incident that happened in our space. I think it was with Fiscal Note. And I'm not going to shy away from it, because I know some people are like, well, but there was an issue with them securing their databases to where people could get in the back end and get people's personal information. Now, maybe it's not credit cards and things like that, but it is personal information that when we're going out and we're asking people to engage with us and we're collecting that information, that they trust us to make sure that we protect that, right? Just like any entity. And these individuals didn't really do their due diligence and protect it, and somebody was not watching what needed to happen. And I know there was an exchange, there was a buyout. I don't want to go into the whole thing, but it really brought to the forefront of my mind, I was like, I really need to go back and start engaging our vendors on what their security protocols are. And I think it behooves all of us to really start asking those questions, if you haven't, to go back and ask those questions. So what do you think? We talked a little bit about it offline, about how this wasn't a small incident. This is a big incident in our industry. We can't have this kind of stuff. People are going to trust us with their personal stories and personal data, right?
No, that's exactly right. Again, whether it's what happened with Facebook and
Right.
and again with the data hacks there and the trust.
And now
it's
even
no
with
different
WhatsApp, like I just
Yeah.
saw today, and I
Yeah.
use WhatsApp all the time, and there was a back end on that, right? So
You're right. So it's a matter of clearly, you try to establish a level of trust anyway among
Right.
your following, among your supporters, and so it is a bit discouraging when there is a breach like that. I find anyway, and I'd love, each of your respective opinions. Most people are forgiving, and I
Yes.
think there's a reason why Facebook's users the number continues to go up even
Right.
in spite of what happened and all
Right.
that.
Right.
And I'm not saying that Facebook, for instance, handled everything perfectly
Right.
either. I mean that's probably could be a topic for a whole other
Right.
help desk show. But I want to frame that because along the lines of what happened with Voter Voice anyway. As an advocacy professional, and obviously I don't use Voter Voice. I do know a number of my peers at other organizations that do. So I'm relatively at least unbiased when it comes to what happened with them, and is that people are understanding if something like that happens. I think what was most discouraging was the response, or really the lack thereof,
Right.
in light of what happened, and or at least it wasn't sufficient enough
Right.
for their existing clients, as well as, I'll be honest, as a professional, when I saw how they responded to it. It made me less likely to want to refer anyone to Voter Voice.
So remind me what
going
happened.
forward.
The problem was identified. I think a tech reporter or something identified a flaw, or someone identified a flaw. I got into a news report, and then it was denied that it didn't exist. Right.
Correct. It was denied at first, and then ultimately it was acknowledged. But
Right.
but then even then, once it was acknowledged, and then what Fiscal Note anyway claimed they had done in order to help rectify the issue, at least among advocacy professionals, was not sufficient.
Right.
And then therefore that Fiscal Note then had to at least be in a position where they had to correct course again.
Right. And it should only happen the first time, right?
It should. As I said, this is why I want to frame it as most people are forgiving.
Sure.
It's like, if something like that happens, again, regrettable. However, it was more of how they responded.
Right. So it happens in tech.
Yes, it does.
It happens in every tech, even good tech, even billion-dollar tech. It happens. But you have to alert people that's using it, let them know, and let them know that it is fixed and that it is actually fixed. You don't want to string it out the way it happened. But I think the story is cautionary in the terms of when we're talking about vendor selection or vendor relationships that we ask the questions about security. And maybe and maybe we should talk about a little bit about that too, but it's like, and Brian can help too from your side about what you hear, what you tell people. But in essence, when you talk about vendor security for platforms, it's where you're storing the data. What are, like, even internally what is our privacy policies? Do we
Right.
tell people our privacy policies? What are we collecting from these folks? So it's like, where are they on the servers? Is it AWS? Is it Microsoft? Is it an internal server? What is the policy for doing, making sure there's software updates? If there is a breach, then what's your plan of action to correct this issue? And then what's your time frame to alert me when that happens? And then what's the best practice to alert if there is a breach? Do I need to tell my advocates? What kind of data am I collecting on these folks? Personal data, things like so. I mean, I'm just thinking out loud of things that it's not just how the software works or what it
Right.
does or what you're doing with it. Right. We need to be serious about the operational side.
One thing to think about too is your own internal processes, right? And I think that a lot of folks put all of that onus on the software itself. And of course, obviously, software providers are the ones that have the data. But far too often, folks come in and say, "Hey, can we get one shared login?" And it's like, no, I'm sorry, that's not how this works. Or can you disable two-factor authentication? I'm like, no, that's not how this works, right? So it's yes, I think that one thing that would be great for Advocacy Help Desk, and we should probably do this, is put up maybe like a little survey or something that just says, here's some questions that we're thinking about asking when talking to vendors.
What we'll do is we'll get one of those flip boards and we'll just stick it right here, and you and I will put on our glasses and we'll go line by line. Right?
I love it.
List it out.
You're going to get the yarn out too?
That's right, yeah.
Oh, yeah, of course.
Yeah.
Oh, of course.
Kiri.
Right. And then we'll circle you in the middle and put all the yarn. This is patient zero.
Social influencer. Let's get all his data.
Right there. No, but the flip side then too is look internally and make sure that you're not only like obviously putting the processes out there, but putting the processes internally of saying, okay, great, we need to make sure that every single user has their own login. We can't ask for a shared login because that defeats security altogether. Right. Somebody gets fired and gets let go, you're going to reset the password. 99% of the time that doesn't happen. And so this person that was just let go now has the password to your database. So it's things like that as a provider we look to also, which is when we engage with new clients or even existing clients, we talk to them every 6 months, every year, just talking to them to make sure, hey, you have this many users in your system. Do you need that many? Are these still all admins, right? Yeah. Things of that sort where you should be thinking about those to make sure that you're doing everything you can on your side to lock it down as well, and not just say, oh, well, it's their fault. Well, not saying it is or it isn't, but look internally like anything and say, did I do anything to contribute to this by setting a bad password, which software shouldn't allow, but still people request it all the time, right? By doing a group account, shouldn't happen. Things like that that you wouldn't think about happen far too often in our industry, and it's almost like we should put up something that says, look, here are questions that you should ask externally, and here are questions that you should ask internally.
Please don't put your password on a Post-it note, a sticky note, and stick it on your laptop.
On your laptop. Right.
Please do not do
Things
that.
like
That's
that.
number one.
I'm crumpling it up right now.
Yeah.
And don't use the word password as your password.
Or pizza
Shoot,
one
that
or
too,
whatever
gotta-
it is.
Yeah, exactly. Right.
What about my birthday?
Make it an exclamation point.
Yeah.
Number one. That's all you need.
Well, I think it's not, and talking about this too, because I love having these conversations because it gets my mind turning. It's not just the reputation that we have as associations with the advocates of making sure that we protect it. If there's some kind of breach and some kind of issue, we've seen this with the elections and the president and all, like it's still ongoing.
I'm sorry, what?
Exactly. The hacking into voter systems and databases, etc. If you're using a system that can't be trusted or is perceived as not being trusted, and you're sending messages to Capitol Hill, eventually, I'm not saying it happens in this instance, but eventually the trust erodes on that end to where they don't want to accept certain things coming from software.
And we've seen that. Right. We've seen that this year where, and your call, whether it was rightfully done or not, right? And that's always going to be the question. But some offices have said, well, you're submitting this letter through a third-party system. We won't agree to that. Even though they've agreed to it elsewhere and signed off on accepting those messages, they now push back because in this era of labeling something as fake news, they can say, well, we thought it was fake, even though it wasn't. And as a software provider, we show you the exact list of every interaction. That doesn't matter to them. And so you're right. That is a challenge in and of itself. What I'm fascinated, Matthew, to talk about a little bit is some of the healthcare data and some extra concerns that need to be done there. Because as software providers, right, a lot of what we do, we refuse to store that data, because that data puts you at a whole other security level that you just don't want to live in, and that's where hospitals live, and that's where others live, and that's great. But for us, it's saying, look, we'll take in what's called PII, which is personally identifiable information, of the smallest sort, which is basically just where do you live, because we need that information to deliver the letter, and that's it, or deliver the tweet or the phone call. And that's as far as we go. So tell me some of the concerns or some of the ways that you're thinking about HIPAA and other things of that sort, and what keeps you up at night.
For us, it's a bit unique because even outside of what we do in terms of advocacy, we do have very thorough security protocols internally to ensure that patient health information is protected.
Love it.
Even in terms of training for individual employees, our IT systems, and so on. And we do not, and we actually intentionally keep that system separate from our advocacy database. And Brian, I think you outlined it pretty well. The type of information we ask for through our advocacy network, which is, again, basically it's more geographically based. If we do send out a survey, again, we can tag them based off of how they responded to particular questions. But even then, we aren't asking for super specific information like what your health condition may be.
Right.
It might be whether or not you are a parent to a child who's a patient at Children's Hospital.
In some of those questions,
yeah.
do you say, thank you for sharing your story. Please check here to understand that we may reuse this to help tell your story to a larger audience? Do you put some of those fail-safes in or safeguards in to just let them sort of voluntarily say, look, I know I'm sharing what may be personal to me, but I want you to be able to use it so that we can build a larger audience?
Right. So what we do is actually, even then, we don't share any of that information externally without that person's consent.
Fantastic. Love that. Yes.
So it's one thing for us to have that. So it helps us in terms of mining potential stories.
Sure.
But then we won't necessarily share it without their consent. And we have actual consent forms that those individuals have to complete and submit to us before we share those in the public domain.
And that includes sort of taking that story as part of like, here's a Hill packet, here's a Hill AR presentation, here's a video of whatever. You're making sure to get that extra layer.
Correct.
Awesome. Love that. Yes. Fantastic. Okay. Because those are always the big questions, right? So I like this because we're talking sort of social influence, right? We're talking about identifying those folks. We're talking about how do we build sort of this groundswell from the data? Because the data, for me, what we get too often is this concept of it's scary and it's this large bucket and I don't know what I'm doing with it. But at the end of the day, it's sort of saying this is the way that we tell a story is with the points that we have, the stories we've collected, and then being able to say, okay, great, give me the stories from Massachusetts 2 because I'm going to that office and I want to talk to them about what's happening in their district. And so how do you catalog? Like what are you tagging your data with? What do you so give me some sort of best practices of ways that you're thinking about, am I cataloging it by patient versus parent? Am I by professional versus somebody else? Stories by senior versus child under 5, child under 10. What are some of the best practices, some of the ways you're thinking about categorizing and cataloging your data?
Yeah, sure. So, in terms of our master database, we use Nation Builder. So in terms of, those who are familiar with Nation Builder, or even if you're not, there are opportunities to put particular tags.
Sure.
And even when we've done surveys for that matter, it's allowed based off of those survey responses. What's your, what issues are most important to you in children's health? And then however, she or he responds, then ultimately will then either connect to their existing Nation Builder profile as a tag, or if for some reason, 99% of the time that's the way it works. If by chance that person isn't yet in our database and they somehow got a hold of, maybe a family member or a friend shared it with them, like, hey, I'm part of this really great network, and really think that you should be too. Then the information is collected. Then it would then create a brand new profile and put that tag on there as well.
Right.
So with all of that all that tagging information, then we can sort. Like I said, in terms of geographically, if it is with a particular member of Congress or senator, as well as based off of those individual tags of basically identifiers, or I call it some type of affiliation of some way to a particular issue or a particular circumstance. And then what we can do, at a minimum, certainly if it's something we need to turn around really quickly, it can be referenced very generically in a meeting. For instance, we are familiar with a family who has these circumstances, without getting to, anything that would potentially reveal the identity of that family, if it was timely, for instance. Otherwise, what we do is we then go through the protocol of what you said, of what I mentioned a few minutes ago, which is between the consent and all that.
But give me some sort of best practices, right? If I'm starting today with a database of, let's say, 5,000 people, right? What are some of the things I should be thinking about for how to tag? And I'll give you an example. We work with a university. They tag by college graduated, degree attained, and year graduated. And then they're able to slice and dice and mix and match to say, here's how we figure out who's working best in our database.
Here's how we're going to bother all the alumni to get as much money as possible.
That's fine, yes.
But until you are earning enough money to donate, you can take this advocacy ask that we have.
There you go. But so that's the way that they do it, right? And I'm not asking you for your specific tags, but more just like best practices. How are you thinking about segmenting your database by profession, by what, so that folks who are just getting started can get out there and do this?
Yeah, I think profession, basically whatever type of affiliation she or he may have to your issue your membership. We can, fill in the blank of who you are or who you're representing.
Sure.
So that's the first place to start. Is then whatever.
So that could be by issue, that could be by profession, that could be okay. All right. So you are doing so thinking about it again, like we said at the step one is not just the patient, but also the people around the patient who have the stories to tell. So you're then also tagging that way too in the data.
That's right. Like if they're a doctor or a nurse or something like that, and they've otherwise again when we have the surveys we send out are relatively common. So it's and we intentionally in those type we send it out usually through email, but you can also get through a text message with a link to click on. But then we ask just one question at a time. So it's not like it's a whole like you're going to be spending 10 or 15
start with
minutes.
One, baby. Back to
start with one.
Start
That's
with
right.
one. So one question: what issue means most to you?
Yep.
Or how do you relate to our effort in general?
Correct. And then there are a series of potential responses, and then you can have an other there where they can fill in a box. I mean, really, otherwise can look like your basic survey. That's how we do it. Again, obviously, there are a number of different tools out there for you to be able to collect that information.
Right. I like that. Start with one is good. I like that.
One is the loneliest number, apparently.
One is
but
the loneliest number.
That is where you start.
That is where
Sometimes
you start.
you're in the wilderness and you find friends. You find these social influencers, and it makes it all better,
All
right?
you need is one to start. I like that.
I think we're hitting the end of our runway here in studio today. Matthew, thank you so much for coming in.
Thanks for having me.
Matthew Wright, who is Advocacy and Outreach Director with the Children's Hospital Association, doing good work for all those families and kids across the country. And as we're talking about fly-ins, I had this idea, and we'll end the show on my idea because I like my ideas, and
That's all I know.
they're all over the place. But sometimes you throw something against the wall and it sticks. What if we started doing FaceTime fly-ins where you took a tablet into the meeting and you had a patient from the hospital bed do the meeting with the member live from the hospital? I mean, or not even the hospital, just from home, right? Because I think there's so much budget issues and not everybody can fly in.
Of course, in the healthcare
but you could
space.
flavor it, right? You could put a big chain around. You could walk around with them, so they can do a physical fly-in while you're walking for them. And it's like, oh, I'm literally advocating for you, but you're telling your own story.
That's right.
By having it, I don't know. Like, I think that's a good idea.
No,
I don't know.
I
Am
love
I
it.
crazy?
I was gonna say, if we had more time, I've actually been pitched on a potential technology that would almost look like a robot going in, but otherwise it'd be a video camera to do just what you
There you go.
described.
Love it.
Now, if it has a hologram, that'd be 10 times better if it's deemed a hologram. And it was a little machine called R2D2, and it just went around the halls and was spitting out little holograms all over the place, spreading your message.
Save me, Matthew.
Yeah.
You're my only hope.
Well, I
Yeah,
mean,
nice.
It's not May the 4th, it's May the 14th.
Yeah.
May the
right.
4th. Sorry, we missed it by a
Nice.
little bit.
Nice.
I still think of old school. Like, I still think I'm going to get a shoe costume and go around Capitol Hill and just hang out and go to like Cannon and like drink, like have a coffee, or just walk through and get. Everybody's like, "What is that guy doing?"
Behind the scenes at Advocacy
Exactly.
Help Desk,
This
right?
is
That's
it.
right. This is it. This is it.
FaceTime fly-ins.
Matthew,
I don't
thank
know.
you for joining us today.
Matthew, thank you
Thank
very
you for
much.
having me.
Thanks for the good work you do. Thanks for sharing your insights, especially about Tom. I hope people will chew on that. And then
One thing.
it takes one thing,
One
one
thing.
step at a time. Start
Yep.
at one.
Start at one.
And then also our great discussion on data security issues. We don't think about that because we're trying to do our jobs day in and day out. But it's a huge factor that we have to look at and think about. So thank you for all your salient points and your work again. And I also want to thank my co-host Brian with Spark Influence and Blake with Human Factor, doing podcasts across America for Americans.
For Americans,
As Americans, American apple pie, baby.
we'll
There
work
it
with
is.
Europeans.
I like it. I like it.
You're so global.
That's
I am.
right.
Folks, this is Advocacy Help Desk. You can catch us anytime at advocacyhelpdesk.com. If you have a current issue or challenge you need help with, drop us a note, drop us questions, drop us issues. We'll pair you with someone who is an expert in the field or a practitioner to give you some help on that. And also go to our YouTube page, Advocacy Help Desk on YouTube, where we stream these live. You can see our complete catalog there, and you can subscribe so you're up to date for the next show. The next show, I believe, is going to be June 4th with our good friend Jessica.
Miss Cooper.
That's right, Jessica
Yes.
Cooper from NFIB. She's going to be coming in talking about her experiences in advocacy and grassroots and trying to run campaigns and programs. So it's just another great voice to talk about different things in the advocacy unit to try to strengthen us all. So with that,
We're out.
Till next time, AHD is
AHD.
OUT. See ya.
I call that freedom. The time